Hyperostosis Frontalis Interna, HFI, is a condition where the inner side of the frontal bone, the bone that makes up the forehead, becomes thicker than normal. It usually does not cause problems and is often discovered by accident when a person gets a head scan for another reason. Think of it like a slow, harmless buildup of extra bone on the inside of the forehead. The exact cause of HFI is not fully known, but several factors are linked to it. Hormones, especially higher estrogen levels, which is why it is more common in women after menopause. Age, it appears more often in people over 50. Genetics, families sometimes have a pattern of thicker frontal bones. Lifestyle, obesity, and certain metabolic conditions may increase risk. Imagine a postmenopausal woman with a family history of HFI. These factors together raise her chance of developing the condition. Most people with HFI have no symptoms at all. When symptoms do appear, they can include mild, dull headaches that feel like a tight band around the forehead, a slight change in head shape that may be noticed when trying on hats, rarely pressure on nearby brain tissue causing dizziness, or, in extreme cases, seizures. For example, a 68-year-old man might say his old hat feels tighter, but he otherwise feels fine. Doctors find HFI during imaging tests. X-ray, CT scan, or MRI of the head can show a thickened inner frontal bone, usually more than 5 millimeters. The thickness is measured by the radiologist. Because HFI is benign, treatment is usually just watching it over time. Surgery is only considered if the bone growth is causing severe pressure on the brain or persistent headaches, which is very rare. Imagine a routine CT scan after a fall. The radiologist notes a 7 millimeter thickening and writes a note to repeat the scan in a few years. There is no specific way to prevent HFI, but general bone-healthy habits may help keep it from getting worse. Maintain a healthy weight through balanced diet and regular exercise. Keep hormone levels in check with medical guidance, especially during menopause. Ensure adequate calcium and vitamin D intake. Think of it like caring for a garden. Regular watering and weed control keep the plants healthy, even if you cannot stop a single weed from appearing. Recent research is exploring the link between HFI and hormonal changes and genetics. A 2023 MRI study showed that women with early menopause had a higher prevalence of HFI, suggesting estrogen may play a direct role. Genetic analyses are looking for specific DNA variants that could make some people more prone to bone thickening. Artificial intelligence tools are being trained to automatically detect HFI on CT scans, which could speed up diagnosis. These advances help doctors understand why HFI happens and how to spot it earlier.